All right, welcome to today's session. Today's session is going to be about OET writing. It's hosted by Aspire Education, and my name is Dr. Anu. To all those who are new here and all those who are old, here is our social media handles. And if you have any queries, you can always email us at oet@aspiretoplab.com or info@aspiretoplab.com. And we have an OET dedicated group. The WhatsApp number is +91 81 05 966 999. So we have a dedicated website and Facebook group as well. Please do check it out. A few terms and conditions to touch upon. All right, so to all those who are new here, because I've been seeing a lot of new attendees, two basic questions. What is OET? It is an occupational English test. It's an English language test for healthcare professionals, and it does not test your medical knowledge whatsoever. So it contains 4 subtests, that is the LRWS, just like IELTS, listening, reading, writing, and speaking. So far, we have covered speaking, and then we even conducted a practice session for speaking, and then recently we did listening and reading. And in the last class, we even touched up one major concept and something that we've been receiving a lot of questions on, that was OET at home. It was hosted by Dr. Ankur Garg. I hope all of you watched it. It was a really informative session. If not, mostly we will be sending the video, and all those who weren't able to get a hold of the video or who were not able to sign in on the webinar can watch the. All right, so let's jump into today's topic, that is the writing subtest structure. So the total time of the test is for 45 minutes. So you'll have a reading time ahead of your writing time. So that is basically 5 minutes of reading time. So in this reading time, you're supposed to plan your response and select the relevant case information. You cannot write during this time or underline or make any kind of notes whatsoever during your reading time. And in your writing time, that is when you actually write the task. So you're supposed to write a letter of around 180 to 200 words in the writing test, in the answer booklet provided. So what is the task? So it's usually a letter of referral or transfer or discharge, depending on which profession you're taking it for. In medicine, it'll usually be a letter of referral. So along with the task instructions, you will receive stimulus materials like case notes or any other related documentation, which includes information that you can use in your response. So what is the topic for writing? So it is profession specific. So for doctors, it'll be a referral letter. For nursing in charge, it'll be a handover, and things like that. And for veterinaries, you will have to probably write a letter to the, one owner or to another. So let's look at the marks distribution. So test takers who want to secure a B grade should actually get around 2 out of 3 for purpose and 5 out of 7 for the remaining criteria. So these criteria I will describe in a few minutes. And recently for nursing, a C+ has also been accepted, but for medical and other professionals, it's usually a grade B. So this is how your writing test will look like. So this is how a model paper would look like. You will have the notes and then a very structured notes, actually. It's very easy to follow. And then you will have the question. So this is the question, and they will tell you what to do in the task. So in this module, you will be learning about the format of the writing test, learn what the OET writing subtest is designed to assess, and what are the different criteria and how to fulfill them so that you can get a better grade. And you will learn about the writing skills and the test strategies that support your test performance. And we'll also be touching up on a few grammatical aspects that is involved in writing, because I think grammar and any writing task goes hand in hand, because as long as you don't touch upon grammar skills, you can't actually produce a good grammatically error-free letter. Possible mind bogglers. And these questions I've actually been receiving from a lot of candidates, so I thought, why not include it here? All right. So, do I lose marks in the writing subtest for spelling mistakes? Well, when it comes to US or UK spellings, either is accepted, but try to be consistent. Um, but otherwise, like say generally words that are spelled wrong, you will lose marks. So spelling along with punctuation and grammar is one of the aspects that is included under language skills. So language is one of the 6 assessment criteria for the writing subtest, and any spelling mistakes you make will be taken account of in your score for your language. What happens if I write too many or too few words in the writing subtest? So there is no penalty as such if you write too many or too less, but usually a good letter would contain around 180 to 200 words. So if you write anything lesser than that, it means that you've left out a lot of relevant information. And the minute it crosses 200, it means that you have included a lot of irrelevant information. So try to focus the word limit between 180 to 200. All right, so how should I address the intended reader of the letter? You should always use the title and address details specified in the task instructions. Please don't add your own. It'll always be mentioned in the task. Use the same. What layout do I use, or where do I write the date and address? So a number of different formats are accepted by health professionals in different local contexts. But yes, having said that, there is no particular single format. But please make sure that your letter is clearly laid out and organized. So yeah, regarding the layout, again, I will be touching up on this in the next few slides. I will tell you the general layout as to what is accepted, what is not in detail. So can I use capitals in the writing subtest? Yes, you can use capital letters in the writing subtest where it is appropriate. For example, say abbreviation of a heading in case you use them, or nouns, or say name of a drug and things like that. Uh, so I can see a lot of questions in the chat box. I will be answering all of them at the end of this session. Is the PowerPoint visible? Because I've just received a message saying it's not. All right. Well, there seems to be no problem from this end. Yeah, so let me just continue. All right. Yeah, people can see it. Those who can't, please check your internet. All right. So how is the writing ability assessed in the OET? All right. So why do we need to look into this? See, understanding how your writing is evaluated by the OET assessors is an important step in performing better for your test. So your performance is recorded against 6 criteria that is visible on the screen right now. So the first one, purpose. So you will need, as I've already mentioned, you will need a 2 out of 3 for purpose. So what is purpose basically? It's about, well, they do get to know about the purpose in the initial introduction itself. So basically, it's whether the purpose of the letter is immediately apparent to the reader and sufficiently expanded in the course of the letter. So basically, your purpose should be, on point in the introduction, and as the letter progresses, you will have to, expand and give enough supporting examples for it. So next one, content. So purpose is the only criteria that's assessed out of 3. Content and the rest will be assessed out of 7. So you will need a 5 out of 7 in the rest of these other criteria to get a grade B. So content is whether all the necessary information is included and if it is accurate for the reader, and if you were able to, sieve out the irrelevant information. All right. Conciseness and clarity. Again, whether you have effectively summarized, and when somebody reads your letter, they should be able to get the main line focus without being able to search for it, and without trying to literally hunt for your reason. It should be well laid out. Genre and style, whether the register, tone, and use of abbreviations are appropriate for the reader. For example, if you are writing for a letter to a specialist, then you can use medical terminology. If it is for a layman, which is hardly ever the case, but if it is for a layman, then you will have to cut down on medical jargons. Next one is the organization and layout. If the letter is structured in a way which aids retrieval of information easy. This is a point that I will be expanding on in the next few slides. And language, whether the accuracy of the grammar, vocabulary, spelling, and punctuations are, whether it communicates the necessary information to the reader. So these are the 7 criteria. Just keep it in mind. It's not something that you by heart or anything. It's just that, when you're writing a letter, if you keep these criteria in mind and then write your letter, you will always get it right. All right. So the structure of the letter is really important. So here is a little task. So match the structural elements on the right side with the letter content on the left side. So I will give you 30 seconds. So just check, assess yourselves, just see what comes after the other. You try to put it in a format, and then we can check the answers. And then I will give you the right way to structure your letter. So you'll have to tell me what goes first and then what goes second and then how you end it. So basically, if you see left side of the slide, you should be able to guess. So anybody who wants to enter the answers in the chat box? I will answer all your questions at the end of this session, so please stay patient. All right, I can see a lot of answers. Thank you so much for participating. I will be putting up the answers now. So first comes the date, and then the recipient information. So regarding the date and recipient information, I will tell you a point regarding it. The thing is, you can put the recipient information first and then the date. There is no hard and fast rule, but this used to be how letters were written. I will tell you in the next few slides about the right way to structure your letter. So then comes your salutation, and then the reference, the body, the closing, and then your name and title. I can see that a lot of people have got it right. All right, that's good. So moving on, as I said, date and address are interchangeable. You can put the address first and then the date, but make sure it is all aligned on your left-hand side. Don't put the address here and then the date on the right side, and that's usually not accepted. So just place everything on the left-hand side. It's easy to remember as well. All right, so first comes in the date. So the date is usually written as day, month, and year. Please do not write it in short saying, 14 /7/14 or something like that. It's always safe to write the date in the expanded form because it looks formal and it's what is right. So as mentioned here, so it's 14th August 2014 in one line, neatly expanded. So leave an empty line after the date. Next comes your address. Use the full name and the address. Whatever is mentioned in your task. Here is just like a brief example. And then again, you leave a line after the address. Next comes the salutation. Dear so-and-so, and if it's a specialist or a doctor, then you use the right name. Then it's usually doctor followed by the name. And please use the family name and don't address the person by their first name, because you only address people by your first name. In the UK or in the US, if you know them well. So since this is a formal letter, you will have to write doctor followed by their last name or family name. So recently what's been happening is you don't need a comma after the salutation, but please bear in mind that if you don't use a comma in the salutation, don't use a comma in your closing as well. Like make it unanimous, or if you use a comma in the salutation, don't forget to use a comma in the closing, vice versa. So leave an empty line again after the salutation. So after each of these, you leave a line. Then comes your reference. So what do we do in reference? You write RE and then you put the name of the patient as explained in the case note, followed by their date of birth, their age and date of birth, sorry. So you say DOB, so and so, whatever date is mentioned, and then again, you leave a line. Next comes your body. In a while, I'll tell you what all to include and what goes first and what comes next in the body, but there is no hard and fast rule. You can always follow your own format, but just make sure that it's well laid out. Like, don't mix up information. So write about 180 to 200 words. There is no ideal number of paragraphs, so it's your wish as long as you keep it within the word limit, and make sure there is a clear purpose for each new paragraph you begin. So when you split something into two paragraphs, make sure they're about two different topics. If it's the same topic, bring it under the same paragraph. So yeah, just things like these. And then leave an empty line after each and every paragraph. Closing, so yours sincerely is the simplest and the most acceptable choice of closing. Again, as I mentioned, if you have used a comma here after your salutation, you use a comma after your sincerely. Otherwise, you don't. And at the end of the letter, you should write your job title, and it's your wish if you want to put your name or you don't want to put your name. So basically, you put your name and then your designation. All right, moving on to the next slide. Here is an example. So as I said, you can always mention the address first or the date first. That is up to you. This is not right. You'll have to expand the date here. And then comes your salutation, your reference, DOB, so and so, and then your introduction paragraph, and then the body, and then the closing. And this is your designation and name. All right, a few things to know when you're planning the letter. Always bear in mind as to who you're writing the letter to, because depending on that, you can use your medical terminology or how complex you can be with your statements, or what to mention, what not to mention. For example, if it's to a specialist, as I said, you will have to, you cannot not mention the the important topics, or what do you say, their present complaints, or what they need to look for. What information do they need to know? What information do they need not know? So don't try to add in every bit of information just because it's mentioned in the notes. It's all about, they're also checking if you can, choose the relevant information and, just discard or leave the irrelevant ones. So only include what they need to know. What is the chief purpose or complaint or the current condition? Always mention that, because otherwise your letter is going to be pretty purposeless, or they're not going to get the point. And purpose happens to be one of the main and the first criteria that they evaluate on. So what information can be grouped together? So check, a lot of times a lot of letters will have similar set of information. So don't try to, just go according to the notes. Just try to group those similar information into one paragraph, so that your letter does not look repetitive. And also, the minute you start repeating too many sentences, you increase your word limit, and if you cross your word limit, it's the first sign that you have put in a lot of things that is not required. Let's move on to the structure. So the opening paragraph. So the first paragraph of your letter should clearly explain the purpose of your writing, as I've already mentioned. So it tells the reader who the patient is and possibly what has happened, where it happened, and now what needs to be done. This paragraph is usually not more than 2 to 3 sentences. Usually it's 2 sentences long, and however, it is packed with information. So more complex grammar, such as conjunctions and relative clauses, are common. It should have professional and formal tone, while providing the reader with important basic information about the patient and your request. So basically, there is one sentence that says what has happened to the patient, and the next sentence should contain as to what needs to be done with the patient now. So that's basically 2 sentences, and that's your introductory paragraph, and that's your purpose. And once that's fulfilled, you get your marks for the purpose criteria. So just take a look at this introductory sentence. Thank you for seeing Ms. Hall, a 45-year-old secondary school teacher who presented today with a 2-week history of GE reflex with possible stricture. I'm referring Ms. Hall to you for further investigations and an endoscopy if required. So they have mentioned what has happened, what they're suspecting, and then they're saying what needs to be done. It's simple, straight, and to the point. So let's move on to the body of the letter. So there are 3 important steps involved in letter writing. So the first one is selection of information. 2 is organization. 3, transformation. So when it comes to transformation, we're basically talking about paraphrasing and grammar and things like that, which I will touch up in a bit. All right. So selection. Selection is nothing but identifying the relevant information. So the instruction is to expand relevant details. And so basically what this means is that you must take time to read and interpret the case notes and decide what is important and what is not. So if, as I've already mentioned, if you include too much information from the case notes, it's very likely that the letter will be longer than 200 words. So here is another tiny task. So look at the case notes and highlight relevant details which you would include in a referral letter to the hospital of Mrs. Bernie's GP about her recent fall. So here's what I want you guys to do. There is the case notes here. What do you think should be written in this first paragraph, the introductory paragraph, as I mentioned? And what do you think needs to be omitted? I'll give you 30 seconds. Again, I can see a lot of questions, which I will be answering at the end of this session. So the name, date of birth, and residence is important. All right. Anyone else who wants to attend this? Let's take a look at the answer. So to the person who said name, DOB, and residence, yes, you've got it right. I'm sorry, I haven't been able to highlight the date of birth, but yes. So you need to include the name, the date of birth, and the residence. DOB usually comes in the reference, so you don't have to write it again. All right. Things that are usually involved in a letter. So I'm just giving you a rough format, but you don't have to strictly stick to this. And please don't consider this like a hard and fast rule and try to go with this, because there are a lot of letters where they won't have mentioned say past medications or past history. They would have directly mentioned only the current history. So yeah. So what you usually include is the patient's past medical history and then the medications. And don't try to make each one of this as a paragraph. Again, this is just a rough format as to how you can go about a letter. So patient's current medical history, patient's current medications, necessary social particulars like if they live alone or do they need help, or necessary physical particulars, exactly, needs walking frame, and if they need help with their household stuff, and what you want done now with the patient. So in a letter, it's important that it follows a simple and clear format, so that its contents can be quickly and easily be understood by the recipient. So once you've selected and extracted the relevant information from the case notes, you need to consider how this information can be organized in the most effective way. All right, here is another task. So before I tell you this, so order of information. So as you write your letter, it is very important to consider how you will order the information. At the same time, you should look for ideas that can be grouped together. Organize in a sequential manner, and those that are similar, group them together. So look at the sentences below and arrange them into a logical sequence by reordering the sentences into the correct order. So these are basically haphazard sentences. And let me know what comes first and what comes next. I will be touching up on a few grammatical aspects soon, so please stay patient. Assuming that a few of you have answered. Oh, yes. All right, I can see a lot of answers here. So let's check if your answers are right. First comes your reference. So I'm referring Mrs. Burney to you for assessment and observation. Next is that she had a fall and sustained an injury to her forehead. So what has happened to her? So is coming next. So as a result of the fall, it is suspected that she may also be suffering a concussion. So this kind of gives me an idea that, in my conclusion paragraph, I will be, telling the specialist if any kind of radiological investigations or if there's anything else that needs to be carried out, it'll be pertaining this. So with regards to medication, she is on paracetamol and so and so. And in the end, if you require any further information, please do not hesitate to contact me. I hope everybody got that right. Even if you didn't, I think by the end of this webinar, you will know, how to organize your letter. All right, let me just do a quick check if everybody can see the PPT and if I'm audible. All right. Formality. So in referral letters, please avoid using contractions like can't for cannot and won't for will not. You'll for, you'll. So informal or colloquial language should be avoided. For example, he has a bug or he has a tummy pain. He's on some meds. He's feeling giddy. Words like that, please try to avoid. Do not overuse personal pronouns such as I. This is one of the most important aspect of a letter writing. It's called paraphrase. So in the writing test, you need to make a grammatically correct, easy to read sentence and also make sure that you stay within the word limit. So to achieve all of this, you need to summarize multiple related case notes, change the order of information so that it's logical or sequential. It has to flow from, one point to the other effortlessly. And then you paraphrase information. Don't just copy the case notes as it is directly. Try to rephrase it or reframe the sentences. Try to use synonyms, which it gives you brownie points. So change the word forms. For example, change a noun to a verb, active to passive. So yes, don't copy directly from the case notes. You should put the information into your own words because this is what shows your language skills. Because if you just copy the same words as it is presented in the case note, you're not what do you say? You're not showing them your glossary or lexical knowledge. Usage of signal words and phrases. So these are the sentences, words that link sentences together so that, it flows smoothly. So here are a few common ones. that you can use. I will be reading it out for you. And one more thing, one important thing when it comes to these phrases or these linking words, please don't use them just because you want to use them, or you want to show the examiner that you know these words. Because I've always, I mean, I did correct a few papers which had these words, but they were used in the wrong forms or in the wrong time. Like basically, they were put in there just to show that, you know, that the person knows these words. Don't try to do that. Always try to make your sentences look more natural and smooth. So if you're giving additional information, you can always say, you can always use the words like moreover, also, in addition to, or apart from this, furthermore. And if you're giving advice, I recommend that you so and so, or it is important to, or please ensure that. And if there is a contrast between two statements, then you use words like despite, however, and although. So if you want to bring emphasis or bring attention to a particular statement that you're making, then you can always use words, phrases like my main concern is, or may I remind you, or what concerns me the most is. And you can always use, to, put the case notes in order. Like you can use words like firstly, secondly, or finally, or yeah. And when it comes to result, you can always say as a result, consequently. You can take a screenshot of the slide so that you try to use this in your letter. But again, if use it only when there are sentences like these, like don't just put them haphazardly here and there. So yeah, and if you're expressing sympathy, then unfortunately or regrettably, your accent is pretty bad. Then all right. So there will be a lot of times where you have to point out at the time of the investigation, or when it was carried out or when it was done. So you can always mention phrases like these: on a review today, or on consultation today, or at that time, recently, and over the past 2 weeks. Sometimes in the case notes there will be a case notes that is at a particular date, and then another case note that will be 2 weeks later. So instead of mentioning the date, you can always say 2 weeks ago, this was the observation, and now it's this. So yeah, things like 3 weeks later, on her next visit, during, since that time, and initial examination. So here are a few tenses. One major thing about tense: if you start your letter in past tense, make sure the whole letter is in past tense. Don't keep a jumping between past tense and then present, and then you go back to past again. So just don't do that. Just try to make sure that your letter is well laid out. So I have a little task to explain these forms. You can take a screenshot if you want. So basically, it's like the word admit. In present tense is admits, and past tense would be admitted. Future tense will be, will admit. So this is what I try to tell you guys. So overall, passive voice can be a very useful tool in improving your letter. I will be touching up on a few grammar aspects today, but due to time restraint, I will not be able to do all of them. So here are a few essential ones, and we will be, touching up on all the grammar aspects in our complete preparatory course. All right, so here's another task. So try to fill in these gaps with the correct tense and voice, the verbs indicated in the brackets. So I think I'll give you guys another 30 seconds. So there are just 3 words that you need to change to the right tense. Again, I will be answering all of those questions at the end of this session, so please stay patient. Reported, referred, and ways. Any more answers? So if you get these right, it means that that you're really good at your tense, and you actually shouldn't have a problem with your letter. And all those who don't, you can always send in your letters for correction, and I can give you the right kind of guidance. All right, so let's take a look at the answers. So this whole paragraph, first of all, is in past tense. So it becomes, on initial presentation in January 2014, Mr. Gilbert reported persistent discomfort in his knee despite taking NSAIDs and oxycodone for pain relief and undergoing regular physiotherapy. He was referred to a physiotherapist for a knee brace, but this has already been answered. But this has had little effect on his condition following his meniscal cartilage injury. Mr. Gilbert began a weight loss program and now weighs 88 kilograms. So I hope people got that right. And here is another task to check your grammar. These are very basic. Hopefully you get them all right. So complete the gaps in the sentences with an appropriate verb and its corresponding preposition. You might feel, that you're solving sentences that kind of don't make sense at the moment, but once you begin to write your letter, if you just bear these kind of, grammatical forms in mind, you will get your letter right. Your letter will be basically grammatical error free. So here are a few sentences. If anybody wants to send in the answers through the chat box, I'd be happy to read them. And I will be giving the answers at the end of 30 seconds. So you'll have to use these words and connect these two sentences. So this is what I mean by changing simple sentences to complex forms. So the minute you combine two sentences, it is a complex sentence, and you back points for that. Yes, the doctor who ordered the tests is unavailable. That's right. Anyone else who wants to answer the rest? Yes, I can see a lot of right answers. So let's check them in the next slide. So the first one becomes, the doctor who ordered the tests is unavailable. The second one, the connector word was which. So a relative brought in clean pajamas, which she placed on the foot of the bed. The third sentence was, the nurse comforted the woman. Her husband had just died. And the clue word was whose. So the nurse comforted the woman whose husband had just died. The fourth sentence was, he placed the records on the counter. You could find them there. And the clue word was where. So he placed the records on the counter where you could find them. The last sentence was, this is the time. We really need extra staff. And the clue word is when. This is the time when we really need extra stuff. So, a simple practice session like this kind of, gives you the hint, or say the practice that, you need to make simple sentences into complex ones. And the more complex sentences you have, shows that, you got good grammar. But at the same time, if you're not able to, or if you try to combine too many sentences, you might lose the meaning. So yeah, don't try to do that. Just try to combine like 2 sentences and not like 3, 4 of them together. So moving on, this is the last bit of the letter, that is the conclusion of the letter. Yeah. So the conclusion of the letter should be in a standard format. It should be based on the task question, which is found mostly at the end of the case notes. So it may contain usually 1 or 2 of the following points. That is a polite request of action required, or a thank you for ongoing support. Please do not write thanks a lot. That is basically informal language. So always stick to thank you. That is formal language. An offer of future assistance if required. So this may be useful if you plan to omit some details from the case notes. Say your letter is becoming too big and you've omitted a few details, you can always include this. Yes, so I have a few examples here so that I can elaborate on what I was telling you guys, because the more examples we see, the more we learn, right? So let me tell you what is wrong first. When in conclusions, can or will are considered informal. So avoid using them. For example, I will be pleased if you can examine, diagnose, and treat the patient as you feel appropriate. So you see, will and as you feel appropriate, all that is informal language. Can you examine and treat the patient as you feel appropriate? Again, can. Try to use could. I will tell you the right forms in the next slide. Can you arrange someone to help this family and provide proper medical support? Again, can. The right way would be, could you please arrange someone to help this family and help with, proper medical support? So also avoid direct sentence formats such as, please examine, diagnose, and treat the patient as you feel appropriate. It should never be a direct instruction, so next one, please examine and treat the patient as you feel appropriate, or please arrange someone. Excuse me. Right, yeah, please excuse me for that. Am I audible? I hope I'm audible. All right, thank you. So please arrange someone to help this family and provide proper medical support. So what you should be using are these. Please use could, or hope you can, and would to write a polite and standard conclusion. You're always asking them for help. You're not, telling them to do it. You're not giving out a piece of, what do you say, command. You're actually asking them for help. So could you please examine and treat the patient as you feel appropriate? Or I would be grateful if you could examine, diagnose, and treat the patient as you feel appropriate. Or I hope you can arrange someone. Or I would appreciate it if you could examine, diagnose, and treat the patient as you feel appropriate. So the passive form of sentence is always more polite and will, make an excellent conclusion. So this is what I've been telling. Sentences in passive form is always the best thing to use and to do because one, it sounds formal, and two, it sounds grammatically right because the minute you are trying to put something into passive form, you're being formal and you're using the words could and would. So it would be greatly appreciated if you could examine, diagnose, and treat the patient as you feel appropriate. So these are the examples. It's not that you should use the same sentences. So these are just a few examples to give you guys an idea. So conditional sentences, please include them. So let me tell you what they are. So these sentences are also frequently used in the conclusion of a referral letter. For example, if you have any queries, please do not hesitate to contact me. Or if you require any more information, please do not hesitate to contact me. Or if you have any further questions, or please do not hesitate to contact me if you have any further questions. This is just a rephrase of the above sentences. Always, always include one of these sentences at the end of your letter. The end of the letter would be the closer, as in the closer statement, name, and then your designation, as we saw in structure. Yes. All right, so leave a space between the last line of the conclusion and then the closer. And then the closer should be followed by a comma. This is when if you have put a comma initially in the salutation. And then you write your name and designation below the closer. So basically it's your sincerely, comma, your name, and then who you are, your designation. It could be anything, just doctor or say nurse in charge, anybody. So a few points to remember before I end the webinar. All right. Word limit and neatness. Again, I'm stressing on this because this is a very clear indicator of, you including relevant and irrelevant information. You don't include all that's required, your letter is going to be within 180. If you include too much or irrelevant information, it's going to be above 220. Neatness. Why am I mentioning about neatness? Is because if your letter is legible, then you bag in points. Say if your letter is all right, I mean, it's, you've got good grammatical sources going on there and you've used a lot of good vocab. But if your writing is pretty bad or illegible, they will not be able to mark you on it. And doctors are usually known for bad handwriting. So let's just be on our best behavior and write it neatly so that it's readable and you get all the marks that you deserve. All right, so relevant information. So don't write down all the information from the task sheet, which does not actually reflect reality. As in, there might be a history that is, say, 20 years ago and it is not related to the present case. Skip it. There is no need for you to mention it if it is not related to the present complaint or if it is not at all relevant. So before you begin writing, please underline all the information that you should be including, or you can put a tiny star, or if you want to organize, all right, this is what I did. I mean, personal experience, when I gave my OET, I had written down numbers, like when I wanted to, put information in a sequential manner. So I put a little 1 or a 2 and 3, so and so, just to, lay the letter out that way. You can even underline whatever you feel is important so that you don't forget those points, and whatever is not irrelevant, just I put them in brackets so you guys can either cancel or use anything that's convenient to you. Do practice before you give your actual exam, so you will know how to go about your task. You might pick up your own, what do you say, shortcuts or uh, tips here and there. All right, so don't start writing without planning your letter, because this way you might leave out information that is essential. Abbreviations. So try to expand abbreviations wherever possible, or if it's a medical jargon and if you're writing to somebody higher up, then you can use the abbreviations, there is no problem. But as much as possible, try to expand it. Don't expand it and then again use abbreviation beside it. Just either stick to the abbreviated form or stick to the expanded form. So you can use words like BP and these common abbreviations if you're writing a letter to a specialist. Please do not use shortened abbreviated, like for example, if for and, there is a symbol that a lot of people use for and. Do not use that in your letter, because that's informal and yeah, it's not right. All right, so the introduction. Your introduction should always contain the purpose of the letter. This introduction is extremely important, so please give them the chief complaint, give them what needs to be done, so that gives them a clarity. Conclusion. Again, always mention what is in the task, what needs to be done. Please make sure you try to finish your letter like 5 to 10 minutes before. This happens by practice. The more you practice, the more sooner you'll be able to finish your letter. And do not submit in your letters without proofreading, because you'll never know when you're writing in a hurry, or when you're tense in that situation, you might misspell the simplest of words sometimes. So once you proofread, you will be able to identify all these mistakes. Always remember why you're writing the letter and who you're writing the letter to. So your language and the information that you place will be appropriate for the reader. Spelling. So as I've already mentioned, both UK and US spellings are acceptable. If it's a noun, and for example, say if it's a patient's name, it will be included in the task. So please just look back in the task and make sure that you've mentioned the right spelling. Am I audible? All right. Okay. Yeah. All right. So as I've already mentioned, you can use, abbreviation. One more thing is, you can use words like BP, but try to expand it wherever possible. And take care with the placement of your commas and full stops. Make sure that there are enough, and make sure that they are separating ideas into sentences. Capitalization, happens right after a full stop. Don't forget to capitalize the words that come right after full stop, and nouns, and say nouns as in the name of the tablet. For example, say if I'm mentioning Dolo 650, then D would be capital. But if I'm writing paracetamol, it's not in capital, because paracetamol is a general term. It is not a noun. It is not the name or of a brand, or it's not the exact drug name. So paracetamol can be written in small, whereas if you write Dolo 650, then D should be capital. I think that was also one of the doubts that one of the candidates had here. All right, so how can we help you? We can check your writing and tell you if you need any improvement, or how to improve your grammar skills. Our email ID is oet@aspiretoplab.com or info@aspiretoplab.com. You can always message us on the WhatsApp number, that is 8105966999. So thank you so much for attending this webinar. We hope this session was informative. And if there are any last minute exam takers, we hope this helped. And we will be coming up with an in-depth grammar that is required for the writing skills of OET. So please do contact us for more details.